Hey everyone, welcome to this week's episode of Hormonally Speaking. I am so glad to be here with you as always. Have a really cool guest today that has an amazing sort of history of similar to myself, going through some what I like to call health breakdowns that, really ultimately brought us to the work that we do. And what happens when you go through these health breakdowns is you try out a bunch of different things to sort of figure out what's going on. And it usually takes some time to get to the root of what is happening, right? And the root can also be multifaceted, whether it's hormonal issues or gut issues or beyond. So I'm so excited to talk today with Dr. Tenesha Wards, who is the founder of Infinity Wellness Center in Austin, Texas, and the Energy Recovery System online functional medicine coaching program. She's a holistic doctor who concentrates on chronic fatigue, GI issues, women's hormone issues from pre to postmenopause to infertility, fibromyalgia, headaches, burnout, and insomnia. She believes in the importance of treating the whole person and not just the symptoms. Thousands of women have found Dr. Wards after not seeing results with traditional practitioners, cookie cutter programs, and expensive supplements. Her holistic approach to wellness means she specializes in finding and correcting the core root cause to conditions like chronic fatigue, chronic pain, and fibromyalgia. Drawing from her personal struggles with Lyme disease, autoimmunity, and Epstein-Barr virus is where she finds the fuel to pursue her passion, helping people heal near and far. You can find her on Instagram at Infinity Wellness ATX and at Dr. Tenesha, as well as her website, drteneshawards.com. Welcome.
Thank you so much. I'm excited to dive in and chat with you today.
Yeah. So, it kind of told us in a bit in your bio what you've been through sort of on a condensed level. So I would love to hear, more specifically about these kind of health breakdowns that you've experienced in your life and really, what happened with those.
Yeah, I love that you call it a health breakdown because that's exactly what it was and what it felt like. The first one was when I was 15. Literally overnight, woke up with joint pain, severe fatigue, brain fog. And the weird thing was I was unable, or two weird things. I was unable to bend any of my joints
Uh,
to the point where they were just like really stiff. I had to run them under hot water to kind of loosen them up. And then I had a giant rash on one of my legs. And
mm,
this was 1994. So they didn't know what it was. A lot of
right.
people now might hone in like, oh, that could be Lyme disease.
Right.
Then we literally spent a year going from doctor to doctor. Well,
Yeah.
that morning, my mom called my pediatrician again. I was 15 years old. And they brought me in through the back door and quarantined me because I really didn't know what was going on. I
Right.
just knew
Right.
I was really sick. And the rash was like, ooh, what, is this
Yeah.
contagious? So I became kind of a girl in a bubble for a second there before, quarantining and things like that were mainstream media
Right.
words. But it took us multiple doctors and really my mom's own research to find Lyme disease is really
Well,
what
and you didn't
came up
really
with it.
have, the internet then
No,
I mean, barely had it then, much less like all of the information that we have access to today. So I can imagine how hard that was to actually find at that point.
she went to the library.
Mm-hmm.
Back
The
we
old
had to like look
library.
up things under infectious disease.
Yeah.
But it was and we went to multiple doctors and they kept saying, I had rheumatoid arthritis, I had lupus, they thought I had MS, like all the things that just kept coming back negative, and it was frustrating.
Yeah.
And they weren't really digging deeper at multiple points. They just said, well, here's some pain meds and some steroids and an antidepressant.
Right.
Like that was kind of what I was given. And the steroids we now know really kind of stirs up the Lyme and makes things worse. And so I
Mm-hmm.
got puffy, I gained weight, I had issues, felt worse. And finally, my mom took it upon herself and found a doctor who there's a lot of political controversy over Lyme disease at the time in Michigan, where I grew up. And like you had to call and say you were just fatigued or had fibromyalgia to get the appointment to get treated for Lyme. It was crazy.
Wow. Wow.
Um, so that was the first time. It took me probably a year to recover and catch back up with school and get back to life. And fortunately I did and graduated on time and got through it, and slowly things got better. But I will say at 15, and I joke about it now, but I was so committed to getting well that, I would be the girl that brought to cheerleading practice. And after a game, everybody went to like Taco Bell and I was eating fruits and vegetables and slices of turkey out of my lunchbox just because I felt so bad that I just didn't care if I was made fun of, or I didn't care, people knew I'd missed school and things. So I had to really change my food then, my diet
Early. Yeah.
And because also I was put on a high dose of antibiotics when they found out it was Lyme, which didn't actually cure it. I ended up having to go an herbal route. I had yeast problems, candida, the whole thing. So I was doing the candida free, the yeast connection diet in, the 90s when it first came out kind of thing. Well, I think that came out like in the 70s, but
right. But it was it gained
definitely
popularity then. Yeah.
was not popular. Yeah. It was not popular. So that was the first time. And I really, truly believed I beat Lyme and spent 2 decades without any symptoms until I had my daughter at 36 and I got really, really sick after I stopped breastfeeding. So a year later, stopped breastfeeding and just the bottom fell out. And I should also preface that even though I had not had a symptom of Lyme in 2 decades, we tested and it was still showing up on my blood. So I started working with a doctor out of Seattle who had a lot of experience with fertility and Lyme. And I opted to do antibiotics to not pass it through the placenta because the herbs could cause miscarriages.
Right.
So, and I talk about this in my book, that if there's one mistake, I wouldn't have breastfed over a year because my body couldn't take it. Talking about hormones and the connection, like my pituitary gland, I think just couldn't do it any longer. So I stopped after a year and, I'm a chiropractor by trade and it's our culture to like breastfeed our babies till they're in kindergarten almost, right? Like
right.
It's just part of what we do, who we are is a profession, mostly like the crunchier ones.
Right.
And so I really felt like a failure, but looking back that I only made it a year, looking back, I had to be on antibiotics to ensure I didn't pass it. That was really all prevention. So when I stopped breastfeeding and I went off of them, the bottom fell out and I thought, oh my gosh.
Because it was just kind of low level, keeping things like, okay, right. And then take it away.
Yeah. Well, and I think at that point, my gut was probably
right. I mean, it just like mutilates the gut to have to be on antibiotics for that long.
And it was a low level, but it was for almost 2 years by the time I, went through the pregnancy and then the year of breastfeeding. And I thought, oh my gosh, the Lyme disease came back. We must have stirred them up with the antibiotics, but it didn't. I wasn't showing really, I didn't have any pain. That was a big thing for me. I didn't have the joint pain. I was just tired and brain fogged and moody. And so doing what I do, I started running my own tests. I was like, my spidey senses tell me this isn't a Lyme flare up. This doesn't feel like I've felt in the past. And that's when I found Epstein-Barr virus and Hashimoto's thyroid, which is very, very common. And I'm sure you see this after pregnancy, after menopause, even seeing it after puberty. We're seeing Hashimoto's show up.
Yeah.
So we don't know exactly what or why it's being triggered, except for a big swing in hormones, I think has a big something to do with the autoimmunity of the thyroid. And so that was.
Can I ask you, did you have mono too when you were younger, or
not that I remember and not that I can recall? However, I tell people mono is the week-long or longer flu. Right. Most flus are 3 or 4 days. And when I say that, most people are like, oh yeah, I was sick for 2 weeks at one point. I was just never tested. And it's hard to say because I was so sick from that time to 15 to like almost 17 years old. Like who the hell knows? Right. It could have shown and expressed then. But no, I was never tested. However, my brother was tested for mono when we were younger. So it definitely was in the house.
Gotcha.
So probably it expressed and, it could have lied dormant until I had Lyme and expressed.
100%. I see that with, EBV a lot, right? It's just like hanging out down there and then something happens, something traumatic happens and boom, that gets flared and people didn't realize they had it until then.
Absolutely. So even though I can't remember a time when I was younger, I was sick enough to say, well, it could have been during this time kind of thing. So I definitely had it in there. And and that's a different treatment plan, right? Than Lyme disease. To get those two things under control, you have to stop the attack. You have to stop the inflammation. So it cost me again about a year of my life of restoring your health. And that just, now I know that could also be an issue. And it did take me only about 90 days to get those Hashimoto's antibodies gone down, which is interesting because an endocrinologist will tell you once you have Hashimoto's, you always have it. It's like, well, if you don't have the antibodies and you walked into their office, they'd never know you had it. So
Exactly.
I agree with that.
And I've talked about this on the podcast before, working with clients who just maybe get their thyroid tested through a GP. And I tell them, get their antibodies tested. Let's make sure. I've had numerous clients' GPs say, oh, don't worry about the antibodies being high. And then even an endocrinologist or two being like, oh, yeah, that doesn't mean anything. Like, that blows my mind.
Yeah, it's a different it's a completely different approach, right?
Yeah.
And what's also interesting, and I know you've seen this, is the TSH could be fine.
Exactly. 100%. And especially in their wide range. Yeah.
And they have an autoimmune disorder. So they're going like this. I've had numerous patients get misdiagnosed with bipolarism, and it was Hashimoto's, because you could be high on Monday and you could be low on Wednesday.
Yeah.
And I've seen the TSH swing that far that you look hypo one day and hyper the next day. Like it's real.
It's crazy. Yeah. Can I ask you, I know that obviously there's probably a whole comprehensive thing that you did to get those antibodies down, but what are some of the big things that you recommend for people to do?
Glutathione is my biggest one. I use a cream topically as well as
on your thyroid. Nice.
On the thyroid, glutathione cream. Yes, it smells kind of like sulfur. So it doesn't smell great, but it's worth it.
You got to do
oral glutathione at the same time. And if you can, intravenous glutathione will flush that inflammation, because the body's doing what it's supposed to do.
Yeah.
It's attacking something that's inflamed or it could have an infection in it. I definitely think that EBV correlates with it. So the body's it's doing what it's supposed to do. It sees it as an enemy and attacks it. So we need to lower the inflammation to lower the attack also. If the person's not off gluten, going off gluten, we don't know exactly why, but the thyroid is inflamed by gluten, and it's partially because of a similar molecular structure to some of the cells. Other than that, we don't know much more, but we know that gluten, attacks it or inflames it. So getting off gluten is a big one.
Yeah.
And then I like to use the animal extract of a thyroid to act as a decoy. Synthroid could be used for this. I use a product by Standard Process called Thytrophin that has sheep thyroid in it. So it's a decoy. The body starts attacking that tissue in the capsule.
I'd never heard that before. Oh, and interesting. Okay. Yeah.
Hashimoto's. But
I use Thytrophin for some of my clients, but I didn't realize that that's going to help as a decoy. That's really cool.
Yep. And so really just bringing down the inflammation while the body's attacking something else is probably the biggest key. In 60 to 90 days, I can get the antibodies under control if they're going on a, autoimmune, low inflammatory diet, like an AIP, because it is an autoimmune disorder, which would naturally take you off gluten. Yeah. And I think glutathione is a secret weapon with that.
Yeah. I hadn't heard that one before. So I definitely will include that in recommendations for my clients, because Hashimoto's, as you mentioned, it's rampant.
The other tip with glutathione is, and I learned this at a conference somewhere, is I started using it on my thyroid. This was 5-6 years ago now, that it's so antioxidant and anti-wrinkle that I started using it as my moisturizer.
Oh, interesting.
The glutathione cream. And I've literally had people in the last couple of years say, you have a glow about you. And I'm like, I think I'm aging backwards from the glutathione.
Glutathione. I love that. So do you think it's okay for people to use it too if they don't have Hashimoto's but have thyroid issues?
I do.
Yeah. Okay.
Because it's just an antioxidant.
Right. It's our master antioxidant. Yeah. Most of us need it.
It's the most potent one in the body. So I think I use it on a patient if they sprained an ankle. I use it if they have back pain. I use it, for Hashimoto's. I use it over the liver topically if their liver enzymes are high, to start lowering inflammation and detoxing the liver. And that's just topically. I mean, you can take it internally and it hits systemic. But when
I love that idea of topically though. Yeah. I just, it's definitely in the mix so much for so many of my clients, especially women, perimenopause, liver issues are just so huge, but I love the idea of the topical aspect of it. So thank you for that tip.
Yeah, absolutely. And it's working as a moisturizer. I'm going to keep using
it. Yeah. I'm definitely getting on top of that. Do you add it? Do you do it by itself, or do you add it to another moisturizer?
I actually just use it as my moisturizer.
Okay. Straight up. Do you have a particular brand you want to recommend, or?
I like Apex Energetics because it has some other, it has turmeric oil in it. It has lavender, which lavender masks the sulfur smell a bit. still kind of has a lingering smell.
Yeah.
Some people break out a little bit from the essential oils in it, like the lavender
Sure.
and I think it even has boswellia. So it's really anti-inflammatory,
Wow. Yeah.
but most people can tolerate it fine. Yep.
Yeah.
Apex Energetics is my go-to. I
Okay.
think almost every brand, Numedica, Neurobiologics, they all have a topical glutathione cream on the market now.
Mm-hmm.
Most of them smell like sulfur. So Apex is the most tolerable one with the essential oils added that most people are like, yeah, I can smell that, without gagging in the morning.
Yeah. Yeah. As exciting as sulfur smell is first thing in your day, you're like, let's get this party started. Very, very cool. I know we went totally off topic there, but I was just like, yeah, so fascinated. So bringing it back to you. So after this kind of year of getting your health back post, stopping, with your daughter, then what happened then?
Yeah. So we were in a huge expansion, just time in our clinic. So, talk about stresses and trauma. So I was being pulled in a lot of different ways. And since recovering from that myself, I created the energy recovery program, which I have since trademarked into the Infinity Way program. And it really is about finding and correcting the core root cause of chronic fatigue because there's so many misdiagnoses and things have been great. Yep. It took me about a year to recover. And I can honestly say my energy's never been better. I've not felt better. Definitely doing a lot of the things we already do in the clinic, digging in, finding it, and then fixing it, which definitely started with gut repair. As I mentioned, having been on the prevention protocol for Lyme transmission, was gut repair is crucial. Like that's almost our foundational starting point for every case. People come in and say, well, doctor, I came in for, hormone issues and anxiety. Why are we changing my food and doing a gut repair protocol? And it's like, well, all that stuff starts in the gut, our brain chemicals, everything. So that just doing the right thing in the right order, putting together a process was really, I was like, I don't want other women to have to go through this. It was hard. It affected my business, my marriage, all of it, just being that sick with a 1-year-old.
Absolutely. Yeah. Well, and I'm glad that you brought that up about the gut, because I'm always telling my clients the same thing, right? I mean, occasionally I'm like, okay, so they're so bad off. We got to go in and sort of like just support those hormones so that they can start to feel a little bit better. But then we need to get in there and see what's going on in the gut. So what is your process of that, doing that?
Yeah. So 2 parts. I am not against giving bioidentical plant-based hormones while the person is healing.
Yes. Mm-hmm.
If they have all their parts, they shouldn't have to be on that forever, in my opinion. If we can fix the pituitary, thyroid, adrenal, speaking to the ovaries, that whole HP axis, going downstream, bioidentical hormones shouldn't be a long-term thing, in my opinion. And at the same time, until we heal the gut, until the liver's detoxing, until we address genetic methylation issues, all the stuff that we do in the background of the process of healing, sometimes it's needed.
Yeah.
For sure, to just get you off the floor, to get you up and going. So definitely the first step is running labs. What the heck's going on? Let's lift the hood. We've got the symptoms. The check engine soon light is on. Let's lift the hood and see where our starting point is. And most of the time it's the gut. So we kind of build you up before we break you down, right? Like heal the gut and then do some liver cleanses, lowering inflammation all throughout the process, and really honing in on what organ, what gland stops sending the messages properly. And oftentimes we trace it all the way back up to the pituitary gland. I would say a lot of cases also are really hormonal cases, are really adrenal fatigue.
Yeah. Yep.
Right.
Absolutely.
The adrenal's not going to send the signal back down to the ovaries. If it's over here dealing with a crisis, right, it's going to rob Peter to pay Paul. If it's running from a tiger or a bear or a boss or a child or a mortgage, right?
Yeah. Or all of the above.
Or a pandemic, it's not going to connect properly downstream to the ovaries. So, just giving hormones and just treating the ovaries is Band-Aid. I think it's what's wrong with allopathic medicine. They're just going after, oh, well, if we give you this pill, you'll feel better. Let's not actually fix the problem and get your body working on its own. And that's the opposite of our philosophy.
Makes sense. So speaking to bioidentical hormones, since you brought that up, a lot of listeners are in perimenopause. And so do you feel like there is a time in perimenopause that maybe if they do go on bioidenticals, that maybe they're going to need to stay on them?
Ideally, 2 or 3 years while you're going through perimenopause and menopause,
Mm-hmm.
that's optimal,
Mm-hmm.
because once the ovaries shut down naturally, again, assuming you're not getting anything taken out, once the ovaries shut down naturally, in a perfect world, the adrenals they'll pick up the slack, right? They'll
Mm-hmm.
still make enough progesterone for osteoblasts and bone growth and osteoclasts, right? And then, we need the estrogen for vaginal secretions and mood, and we need all the hormones for hair, skin, nails, a muscle tone for testosterone. Like, we need all that still. We need a low level of estrogen, progesterone,
Yeah.
testosterone. Not enough to make a baby and hold a baby, but the adrenals can make that much. Here's where it gets tricky, is most of our adrenals are shot.
Yeah.
And so they're just not making it.
Yeah.
Because they're exhausted. So that's where I think that, yes, maybe giving those hormones, so life isn't treacherous through that, specifically progesterone. And I shy away from giving much estrogen. However, it's sometimes needed. You, of course, never give estrogen without
Progesterone.
progesterone. And
Yep.
that's a miss. I can't
Mm-hmm.
even tell you how many patients walk in my office taking straight estradiol or a
Yeah.
straight estrogen patch. And I'm like, okay, what's your progesterone look like? And they're like, I'm not taking progesterone. And I'm like, oh, this is why you're here, because you feel like you're a mess,
Yeah.
because you're highly emotional because of all the estrogen. So
Yeah.
it,
And the increase in possibility of cancer. I mean, it's like, it's
right,
crazy, right?
right. So the first
Yeah.
thing I get them on is like DIM to
Mm-hmm.
clear the estrogen through the liver.
Mm-hmm.
Like, okay, you've been on this synthetic. And that's the other thing too. Sometimes it's bioidentical, sometimes it's synthetic. Either way, if you're giving estrogen without progesterone, you're going to feel off.
Yep.
However, but I do think maybe those 3 or 4 years, it's worth being on if you
Mm-hmm.
are under stress, your adrenals are overworked, and sometimes even after for a while, because the adrenals, until you can heal them, they're
Mm-hmm.
never going to regulate the hormones. So you need something to feel okay.
Yeah. Yeah,
Do I
absolutely.
think it's lifelong? Ideally not.
Yeah.
And sometimes, I have patients here that work in high stress tech jobs, and they're like, I got 10 more years of this job. Just
Yep.
keep me upright.
Yep.
So,
They're like, you will pry it out of my cold, dead hands.
yes.
You're like, okay.
So I meet them where they're at too.
Yep.
Like, they'll just tell me, some of them work in tech, and they're like, I'm up at 3 a.m. every night, speaking
Jeez.
to somebody overseas. It's like, all right, your adrenals are never going to heal if you're breaking up sleep like that.
Exactly.
They're
Yeah.
just not.
Yeah.
So yes, let's not take your hormones away because you're going to crash.
Right. Absolutely. So going back to adrenals, because we just kind of started touching on that and then I went the bioidentical route, but what are some of your favorite ways to start, supporting the adrenals?
Definitely lifestyle changes. And
Mm-hmm.
sometimes that's not possible.
Yeah.
Sometimes, I say we need 6 hours of uninterrupted sleep for the whole body to heal, but definitely the adrenals.
Mm-hmm.
Regulating the circadian rhythms. And so I do a lot of that with calming herbs,
Mm-hmm.
adaptogenic herbs. And sometimes people, they're this wired and tired. They're up all night, wired, and they're exhausted, and then they can't sleep. So sometimes I'll just mimic the correct cycle for them until we can
Mm-hmm.
heal it. So I'll give them some sort of stimulatory herb in the morning,
Mm-hmm.
calm them at night. And sometimes I use brain chemicals like GABA with it too.
Mm-hmm.
So I'll try to create the correct 24-hour circadian rhythm where they're high cortisol and it slowly lowers in the evening. And that's sometimes what we have to do. We just have to go in hard and fast and kind of create it for them so we can
Yeah.
get the body to start doing it on its own.
Yeah.
A lot of it, again, like the phytrophin, I use a lot of the protomorphogens for healing the adrenals.
Mm-hmm.
A lot of things like rhodiola, ashwagandha, these adaptogenic herbs. Again, though, if stress will trump the best protocol. So if
Yep.
they're just in fight or flight, we may not heal the adrenals.
Right.
But then also addressing pituitary and thyroid and ovaries, so the adrenals aren't overworking, right? So sometimes giving the hormones will give the adrenals a break to have to regulate the hormones
Yeah.
to let them heal too. So there's so much with it. There's
I
so
know.
much
And it's like sometimes trying to figure it out, right? It can take a minute to figure out sort of how to go in. Do you like adrenal glandulars at all? Or you?
Yeah.
Yeah.
Yep.
Mm-hmm.
I definitely use a lot of glandulars too to
Yeah.
rebuild. The analogy I like to use is, how do we build muscle? It's protein, eating animal muscle. And so same kind of thing, build up the
Mm-hmm.
adrenals for sure. One simple thing is I tell people to wake up at sunrise and try
Mm-hmm.
to go lay down at sunset, which is hard to do when, it's winter and it's early, but waking up and being outside when the sun is coming up
Yep.
wakes up the hypothalamus, the pineal gland, the pituitary. All of that tells the brain to start making all the morning cortisol and hormones that we
Yes,
need to get through the day. So sometimes it can be that simple.
absolutely. Yeah.
I mean, that's just part of it, right?
It is. But it's like, I always start with that with clients too, because it's free, and
Yeah.
it's such a good, easy way, and sometimes people will say, well, what if it's not sunny? I'm like, well, I mean, obviously if it's dark, then you're going to have to do something different. But even if it's cloudy, there's still light, right? It's still going to
Yes.
trigger through your eyes, that cortisol to start going up.
Yep.
And so,
Yes.
because people always often want that pill, that thing, and it's like, really I'm glad you're focusing on the lifestyle component, because that's essential.
Can't trick nature. You can
Nope.
try,
Yeah.
and you can override it sometimes, but it's hard. And then at night, shutting that right brain down to bring
Yeah.
down the cortisol to make more melatonin is, yes, it might be dark out, but what screen is in front of us that's keeping
Yeah.
the cortisol up, right? Especially scrolling social media. I think the anticipation of what's going to happen next, like it's just, yeah,
It's just
we're
not
just
good. Yeah.
really
Yeah.
making a mess of our endocrine system right now in the
Right,
world.
right. I just started actually today on my Instagram a little like body spring cleaning thing, and spoke to sleep first, right? And this nighttime ritual, because one of the things, so I as many listeners know, I had a surgery that went wrong that led to some emergency surgeries, and I was in the hospital for quite some time. And I got really dependent in the hospital on just having, like TV playing in the background, in order to help me sleep. And so
Yeah.
I find myself sometimes going back to that, where I'll just have, it's on my computer, which is like even worse because it's in the
Yeah.
bed, but just to have that sound to help me sleep. And just a couple of days ago, I was like, all right, I got to like clean this up again. Right. Because even though I still sleep with it, I know I'm not getting that deep kind of sleep.
Right.
I'm definitely waking up more often. And so just that, pulling the computer out of my room, taking the phone out of my room, unplugging as much as I
Yes.
can, and the Wi-Fi is in the next room over, unplugging that. And it's amazing. You feel it immediately that night,
Yes.
just the deeper sleep that comes from that,
I
So
agree. And it's
yeah,
hard to get away from that stuff, right? It just
it
is.
is. It is. And one of the things that, another thing that I tell people too, like for me, it's about also getting like a really funny or just easy to read book that I am wanting to get into bed with and read at night, because nothing like heavy, nothing that's going to work my
Yes.
mind too much, just something that's going to be that sort of transition to sleep.
Another tip I heard a couple years ago was playing the Sudoku math game at night, or
Mm.
even just sitting there adding 4 plus 4 will turn on the left brain, which calms down the right brain, which is our
Oh,
visual, keeping you active, why the screens, why the television keeps you up.
right,
But
right.
if you can get into your left brain, which reading, not
Yeah,
a Kindle,
right.
right?
Exactly.
Actually,
Like a
a
real book.
paper,
Yeah.
because of the light, even if you
Yep.
have it down low, the light still activates that
That
right
blue light.
brain.
Yep. Mm-hmm.
But yeah, reading, math games, anything like that, it will activate the left, which then calms down the imagination in the right. And then you can go down, your cortisol will lower. So yeah, no, reading an
Interesting.
actual book, right? Who still does that?
Yeah.
Um,
I know. I know.
it's the
I know.
right thing to do.
It really is, it's like this really simple, it's just kind of going back to the way that we did things for like millennia, essentially, right?
Right.
And
Getting
that,
back, you're absolutely right.
yeah,
Getting as close back to nature and
yeah,
earth that we can is really, I think, what's going to save us.
yeah,
And we're so far removed from it. So
yeah,
far removed from it.
absolutely. So, can we talk a little bit more about Lyme and
Yeah.
EBV, because these are such prevalent things that I think are just starting to come to the surface as being more well known, right? And a lot of people don't know they have them. So, yeah.
Yes, I would love to. I think Lyme is an epidemic that we're just not talking enough about.
Mm,
May is Lyme Disease Awareness Month,
mm-hmm,
and it's just not being talked about here in Central Texas. And I know it's where you're at too. It's
mm-hmm.
wooded. It's, there's deer in our front
Ticks
yard.
everywhere. Yep.
Yeah. And it used to be like this strain was on this coast, this strain is on that coast. Now it's all just everywhere. And
Yeah.
I will definitely make this bet any day. More than half fibromyalgia cases are Lyme disease. More than half
Mm-hmm.
chronic fatigue cases are Lyme disease and or EBV. Probably more like 70 or 80%,
Yeah.
honestly.
Yeah.
And I started realizing this in my practice when people were coming in early on with fibromyalgia, and I'm listening and having gone through this myself, and my, again, spidey senses or medical intuition or just knowledge is
Mm-hmm.
going off. And I'm like, well, what's causing the fibro pain?
Right.
This sounds exactly like Lyme. What do
Yeah.
you mean, you're too tired to lift your head? That's not just chronic fatigue syndrome. What's causing the chronic fatigue syndrome? And both EBV and Lyme are what we call stealth pathogens. They hide, so they're not easy to find. Sometimes your body can get so used to them in these biofilms that they don't even spike white blood cells so much. So,
Mm-hmm.
and so that on a normal range, right? A functional range is a little tighter, and we'll pick it up.
Right.
If it's a high normal or a low, it's still in normal range, but it's a high normal.
Yeah. Can I ask if you see low white blood cell count, is that a good indication?
Over time?
Over
Yep.
time.
If it's
Yeah.
chronic, if it's
Yes. Okay. Because I have a
the
client
analogy I
that's
like to
going
use,
on. So I'm just curious.
the analogy I like to use for that one is when there's an intruder, the
Mm-hmm.
white blood cells go out like the Marines. Like
Mm-hmm.
they're the first ones on the boots on the ground. Like there's tons of them and tons of them and tons of them. And if the bug is winning, the white blood cells are dying. They're being killed off. So now that lowers. So when it first happens, all the white blood cells are all hands on deck. And then if it's been 6 months, 9 months, a year, 2 years, the body count of the white blood cells has gone down and down and down. And now it's chronically low.
Yeah.
There's nothing that triggers me more than when a patient comes in and they have, you've been there, the binder of blood work. They've been to doctors for a decade, and they're like, yeah, the only thing we're really noticing is my white blood cells have been chronically low for the last 8 years. And I'm just like, and my doctor said it's normal because, they're not really finding anything because they're not running the right tests looking for the right bugs.
Mm-hmm.
And
Mm-hmm.
yeah, I'm like, this means something. If your white blood cells are chronically low, your immune system's not up to par. That's
Right.
one problem. But B, there is something causing it that's not only causing it, but winning the fight against you.
Yeah.
So they're hard to find. They're definitely not the testing for Lyme disease, the simple ELISA test that you do in blood that any lab could do, clinical pathology or LabCorp, these nationwide labs, is only 60 to 65% accurate because these bugs can hide.
Right.
They can get out of the blood. They can get into the connective tissue. And I'm talking Lyme disease and all the co-infections that are also tick-borne vector spread. So we like to do a blood spotting test, which is a little different how it's read, and also urine testing. And the big thing about the urine test is I have patients go for a lymphatic drainage massage before. And so we're stirring up these bugs in the lymph, and then they're urinating. They take the second urine after the massage. So we're pushing it into the bladder and out. Yeah. So that still is not 100% accurate test. It's 90 to 95% accurate.
Much better. Yeah.
Much better. Yeah. But again, these little things are sneaky little suckers. So they're hard to find. And then they're also a whole nother hardness to treat
them. Yeah. And do you think that Lyme is found in more than just ticks?
That is a dying question that has not been totally proven by the CDC, but I think spiders and mosquitoes and fleas. Absolutely.
I've been reading about mosquitoes, and I mean, that just makes sense, right? Because, I think most of us have probably come across ticks without realizing it, but still the fact that it's so prevalent and not everybody necessarily is getting bit by ticks, it just seems like it's probably in other species too.
Totally. I mean, a lot of people are like, I've never hiked.
Yeah.
I don't have a yard. How did I get a tick?
Yeah.
That kind of thing. Also, they question, is it spread sexually? And we know it can be, that hasn't been proven.
Right.
We know it can be spread through the placenta. That has been proven because they found it in the umbilical cord and things.
Oh, wow. Yeah.
So that's why I took the preventative measures. But yeah, who knows how else it's being spread? I think it's, again, not being studied enough and not getting the attention it needs.
Right.
Because it's not killing people by the masses, it's just debilitating them.
Right. Long term. Yeah. And I did a project a few years ago with women that we called it hidden, because it was like hidden illnesses, right? They look fine. Yeah. They actually, most of them are very beautiful and, very well put together, but they've literally been living with undiagnosed chronic illnesses, or they're given, fibromyalgia, this and that. and just get passed on from doctor to doctor to doctor. And it's
Yep.
like, there's something underlying this. It's not just these
Totally.
things happening. Yeah.
Totally.
Yeah.
Yes. And that's the hard part, right? You don't look sick
Right.
oftentimes with things like Lyme disease and Epstein-Barr virus. You look tired
Yep.
sometimes for sure, but it's not. And it's just hard. It's hard to find, and it's
Yeah.
hard to explain to people the pain and the fatigue, because it's not just, oh, I'm a little tired, or
Mm-hmm.
oh, I'm sore from working out. It can be debilitating. I've had patients that have been bedridden for decades.
Yeah. So when you find Lyme and or EBV, do you often go sort of the antimicrobial route, or does the antibiotic route come up too?
So in my scope, I don't use antibiotics. I use
Mm-hmm.
all herbs,
Mm-hmm.
but that's not the starting point. If someone comes in, we find Lyme and we go in straight for the kill, they're going to crash.
Yeah.
They're going to Herx beyond Herxheimer, which is a word named after Dr. Herxheimer for feeling worse before you feel better when the
Mm-hmm.
bugs are dying.
Mm-hmm.
We have to go through the whole process. And this is our Infinity Way process of, we have to heal the gut, balance
Mm-hmm.
blood sugar, balance your pH, detox the liver, lower inflammation in the body, all increase any, gut microbiome that you're missing, increase any vitamins, nutrients. We run a micronutrient test. We have to build all of these things
Mm-hmm.
up to get ready, open up lymphatic drainage pathways. We have to do all this stuff so that when we kill the bugs, your body can get rid of it, because
Mm-hmm.
Lyme specifically, and this isn't the case in EBV, and I'll explain that in a second, but Lyme specifically, the bugs let off a neurotoxin when they die, which make you feel bad. And so you need to get rid of and flush that stuff. And we use binders and all the other stuff to help
Mm-hmm.
flush it. But, the body has to be able to manage the die off,
Mm-hmm.
or you're
Mm-hmm.
just going to stir these bugs up and make them mad. EBV is a little different, right? Because you can't kill a virus. The analogy I like to use is, once you have cold sores, herpes virus, right? Simplex 1, you always have it.
Mm-hmm.
It's just, can we keep your immune system here and the virus way down here, that you're not showing or expressing a cold sore?
Mm-hmm.
So if we can
Mm-hmm.
keep this balance, the minute you go through divorce, you have financial problems, you get COVID, you got the flu. Now it's, these viruses are like party time,
Yep.
and that's the same with EBV. And this is going a little off topic, but we're seeing a lot of post-COVID long
I
haul
was going to
symptom
ask.
cases.
Yeah. Mm-hmm.
Every single one of them has an active infection of Epstein-Barr virus. I don't know what
Interesting.
came first, the chicken or the egg. I
Right.
don't know
Right.
if because they had COVID and it hit them and the EBV was already there and it expressed, or do they have EBV and it was right here and
Yeah.
then COVID just put them over, and
Yeah.
they can't recover because of the active EBV. But that is something that I think needs to be mainstream. That's not
Yeah.
being talked about. I found that, and significant methylation defects in every single one of them.
Interesting. Okay. Can you speak? We've been talking a little bit recently on the podcast more about methylation issues, but can you speak to that and sort of how that connects?
Yeah, methylation is essentially your MTHFR gene for short, and it's the body's ability to take in what is put into or on the body. So food, lotion you put on your body, air you're breathing, stuff in the water, preservatives, everything that comes in, the body says, do I want to detox this? And this is the methylation pathway. Do I want to send this next down the detox pathway, get rid of it? Or can I keep it and convert it into methyl tetrahydrofolate, which is the methylfolate form, or methyl B12, methylcobalamin. And then those two forms, methylfolate, methylcobalamin, so methyl B9, methyl B12, then go into another pathway of 250 other chemical reactions to make energy.
Mm-hmm.
So essentially, methylation, even though it's kind of being called the detox support system, which it
Mm-hmm.
is the first step in the detox system, it's really more of a sorting system. Do I want to keep this, or I want to detox it? Do I want to keep it and send it through the methyl pathways, or detox it? And so I think everything goes to that pathway, even bugs, infections, everything,
Mm-hmm.
right? Food
Mm-hmm.
dyes, all of it. So I'm wondering if these people are just not able to recognize the bad stuff quickly, and bugs are getting through. I don't know exactly.
Mm-hmm.
I don't know exactly
Yeah.
why, but all of them have significant methyl pathway defects, not just one of them, like 6
Right.
and 7 of, because also the other thing where I think mainstream medicine is starting to catch on, but they're only running the 2 MTHFR genes. We run all 18 in the pathway. you might not have the MTHFR gene itself,
Right.
but you have the 4 but before that step. So you're not even going to get to that step. So you have to look at the whole pathway to determine if somebody has a genetic defect in their methylation system.
Right. Makes sense. And, I definitely have sort of been seeing more and more with the estrogen metabolism, like the COMT issue at
Yes.
play, and so do you see that also, like estrogen metabolism issues in these patients too?
I haven't made that with the long
Mm-hmm.
COVID
Mm-hmm.
necessarily.
Okay.
However, a lot of them are having cycle problems,
Mm-hmm. Mm-hmm.
so
Yeah.
possibly,
Yeah.
I know with the COMT gene, I definitely tell people you can't break down synthetic estrogen. Get the estrogen out of your hormone, out of your meat,
Mm-hmm.
hormones out of your meat. Get off the beauty products that are tightening, plumping, firming.
Yeah.
That's all
Get on your
hormones.
glutathione.
Get on, yes, and don't take birth control.
Yeah.
These are the patients that they'll say, oh yeah, I went on birth control when I was in my 20s and I gained 40 pounds.
Right.
Yep, because you can't break down that synthetic estrogen. Estrogen makes us fat. That's what breast tissue is made out of. That's why they pump chickens full of it, right, to fatten them up. So yeah, you couldn't detox it.
Yeah.
But I haven't made that connection with my long COVID patients. I'm going to go back and take a look at some of them that their cycles are really off, and see
because
if
that's
they have
been a
the
huge
gene.
thing, right? That
Yeah.
for both people, or I've noticed in my practice for both people that have had COVID or have had the vaccine, it's like both of those can throw off the cycles and
They're triggering the
inflammatory
same
markers.
stuff.
Yeah,
They're
exactly.
triggering the same
Yep.
problems with people. Yep,
Yep.
I agree. I 100% agree. No, I definitely should go look at that, because I'm seeing a lot of irregular cycles with both.
Yeah. Yeah. So fascinating. Well, I could talk to you forever. There's like so much. I love how you've made all these connections between all of these areas. And, I agree with you on like 100% of it. And it's so important. And, I think one of the things that may be hard for people coming in is like, okay, so it is this big, overwhelming thing, but working with someone like you, taking them through the process and sort of understanding where they need to hit first. So yeah, can you talk a little bit more about the program that you run?
Yeah, so the first visit with people is an hour long, and we do what's called a timeline health history, age 0 to 10, 10 to 20. Like, we go through every decade looking at major traumas, surgeries, dental work, exposure to ticks, toxins, mold. We didn't even talk about mold.
I was going to say, I was going to bring up mold earlier, and then I was like, yeah,
all the stuff.
Yeah, all the things.
So we go through every decade, as much information as we can, and then we list out all the major symptoms and rate them, 10 being the worst. I put those two things together and decide what labs to start running. Then when we get the labs back, I really kind of take a step back and figure out what's going on, what's our starting point, and then we have a couple different programs we put people into. Right now, it's either 3 or 7 month of just really doing the right thing in the right order, building you up, breaking you down, digging into the underlying causes and fixing what we find.
Nice.
Sounds simple. It's much more complicated depending on what we find.
Yeah, absolutely. Absolutely. 100%. So if you work with people all over, I take it all over the US via this program.
And we have some patients out of the country. It's a little harder sometimes to get blood drawn, but we've done it.
Okay.
Yep. So with the great thing through COVID is we really pivoted and went more telehealth. We wanted to go that way anyway. So yeah, we're really able to see people all over the country, and it's great.
Awesome. So they can find out more at your website. Is that correct?
Yeah. So the office website is Austin Holistic Doctor, which is DR. Okay. My personal website is Dr. Tenesha Wards, TENESHAWARDS. Yep. So nice. Two spots they can find us and work.
Okay. Sweet. Well, I appreciate your time today and like just sharing all this amazing information with us. It was so great.
Absolutely. It was great fun.
Yeah. All right, you guys, I will see you next time.